I'm losing while people are gaining.
37-year-old mom Amanda Kynes Phillips of Cairo, Georgia's weight has changed during the pandemic. For her, being healthy for her kids was a priority.
I'm from the South. We love our Southern comfort food. Give us the fried food, the sweet tea, girl. I mean, I didn't exercise. I just didn't. You get to a point you don't really realize how big you've gotten.
With a family history of weight issues, she opted for a mini gastric bypass surgery from Dr. Michael Snyder, traveling to Denver to get the procedure this summer. This week, she returned for a 4-month follow-up. She's lost 55 pounds.
There's no intolerances or anything like that?
Just the spinach, just the raw spinach.
Dr. Snyder says from Zoom consults to surgeries, his practice, which includes 4 surgeons, is at capacity.
As if we needed another threat to call to action obesity. And taking care of your obesity, this is really a very provocative and important one.
Hospitals have ramped up elective surgeries after pausing for months earlier in the pandemic. Patients like Amanda are causing an increase in bariatric surgeries. Procedures like gastric bypasses, laparoscopic bands, and gastric sleeves restrict stomach size and alter the signals between the stomach and the brain.
The hope is that the weight loss will help them in the fight against COVID.
When you are healthy and you are physically fit, that your immune system is not as compromised.
It's been shown that people do worse with viral infections and infections in general when they're obese. And in addition, the success of a vaccine is limited in people that are obese for any viral vaccine.
1, 2, 3.
That's right. Vaccines don't work as well for those who are obese. While we don't have a COVID vaccine yet, take a look at the flu shot, for example. Research from 2017 showed vaccinated obese adults were twice as likely to get the flu.
Obesity is 42+% of Americans, and if you're African American, it's much higher. So it's really an important problem, in terms of our public health of America, and it's not something we can ignore.
You happy?
I am.
What's going on?
Just having more energy, not feeling tired all the time.
For Amanda, she's so glad she's made the choice to get her surgery and has some advice for others who might be considering it.
If you're scared, there is absolutely nothing to be scared of. This is your story. This is your life.
Lindsay Thies, Newsy, Denver.